early prevention, as I've said in my last video, is better than cure. So knowing how to do this is absolutely utmostly important, guys. It is so important. It can save lives, it can save money, resources, and just so much of stress. You can alleviate those things once you are able to perform this test by yourself. Hi guys, you're welcome back to my YouTube channel. This is Dr. Bella. I hope the Lord has been good to you, your friends, your family, and your loved ones. And if this is the first time I'm all up on your screen, hey, hi, what's up? Are you doing? Please click the subscribe button and join the blessed family. God bless you. Amen. Guys, my last video was an introduction to breast cancer, and I said it at the end of that video that I would be doing another video explaining breast examination. And so today this video is all about that. If you'd like to know more, let's jump right into it. Before we go into the different steps that it needs to be taken for breast self-examination, I quickly just want to share with us some of the common signs and symptoms that you may find in the early breast cancer stages. Number one, if you've noticed any change in your nipple. For example, if it used to be pointy, now it's retracted, and this is exclusive of breastfeeding mothers that could have nipple retraction sometimes, or persons who have had nipple retraction from the get. I'm saying if it is that your nipple on a normal day doesn't retract, now it's now retracted, that's a change. If you've noticed any dimpling of the skin around the breast or the areolar region, if you've noticed any discoloration, if you've noticed any discoloration of the skin, as I said, around the breast area or around the nipple, or even around the areola, which is the black area that surrounds the nipple, these are some of the changes that you want to look out for. But most importantly, lumps or masses, things that are not usually there, things that are not common. And this is the reason why breast self-examination is important. Another thing is if you have an abnormal nipple discharge. For example, is it bloody? Is it super painful and it's bloody? These are some of the changes that you want to look out for, and you can report this to your physician. Now, there are some precautions that I quickly want to talk about before we jump right into the breast self-examination. Do not perform this breast self-examination during your menstruation or before. The reason is because your body goes through some hormonal changes that can cause painful nipples, tenderness to the breast before or during your menstruation. So it is advised that you do this every month, but you do this after your menses, where the hormonal changes have kind of subsided a little bit before they kick back up again. Also have what we call premenstrual syndrome, whereby some persons may have bloating, lower abdominal pain, breast tenderness, nipple tenderness, hormonal changes, mood swings, nausea, vomiting, some of these symptoms before they start their menstruation. Do not perform this breast examination at that time, because some of these symptoms may mimic what you might be thinking is breast cancer, which is just your hormonal changes, and it's not. Enlargement of the breast is also common during the premenstrual and the menstrual phase, and it can also occur as well in the early stages of breast cancer. So you want to make sure that that's not the case before you perform your breast self-examination. So apart from those periods of time during the month, you're free to perform your breast self-examination. Now, let's jump right into the breast self-examination. I have devised a simple method for this breast examination. Bear in mind that there are many methods out there, but I'm just going to be focusing on a particular breast self-examination. If it's comfortable with you, you can go ahead and use this method, but I know that there are other 2 or more methods out there that are explained by other physicians or even online that you can look up and search for. But I believe this is the simplest one and it's the easiest one. And I have devised it as a simple way by saying, look, touch and feel. Okay, so this is my method called the look, touch and feel method. I have devised this method for persons who, first of all, they haven't done a breast self-examination before, or they've done it but they were not getting through, or it was difficult for them and they're not sure how to go about it the next time. So this video is for you if you've ever had to perform a breast self-examination before but you got confused along the way, you're not sure if you're even doing the right thing, you don't even know what it is. This video is for you. Or you have never done any breast examination before, this video is for you. Or you've done this before but you would like to have another method at hand just in case you forget one or two steps in your formal step or in your formal method. This video is also for you as well. Please share this video with someone, a lady, a man. Let them learn about this breast self-examination. Before you start your breast self-examination, I advise that you do not take any alcohol or any medication that can alter your mental state. The reason is because you want to be in charge and you want to be in control of everything that you're going to do around your self-breast examination. So here is my look, touch and feel method. As it says, look. So you're going to stand in front of your mirror and you're going to examine your breast. Of course, your clothes is going to be off and your undergarment is going to be off as well. And you're going to take a close look at yourself. Let me give you an example. The part of your breast tissue extends all the way into your armpit. So what you want to do is, you want to look at your armpit, you want to look at the anterior portion of your shoulder. This soft pad that I'm touching right now is actually part of your breast tissue, and it extends downward into the thorax or into the thoracic region, which is where your breast, the major or the bulk of your breast is. So you want to look in all of this direction. You want to look for any skin changes, any discoloration, any dimpling of the skin around this area. You want to look and make sure that there is nothing here that is different from last month or different from before. Once you look and you see that there is no difference, you take your hand and go to the other side. You can start from whichever side you want. You can start from the left, you can start from the right. It all depends on you. So you're going to do the same thing and repeat the process on this side. If you want to take this further, you can look towards your neck region all the way up to your chin area and the back of your neck. The reason why you're looking into these places is because we have something called lymphadenopathy. When you have any problem in the breast tissue, the ducts or the channels of fluid that drains from the breast usually goes around the neck region towards the back of the hair and towards the chin. We call them the lymphatic channels. Some of these are like little nodes that help in fighting infections, but when they are overwhelmed, sometimes they are swollen and they are painful, and sometimes they are swollen but they are not painful. In whichever case it may be, you might look out for some of these things and look and see if there is any visible swelling around this area. That's just an additional test. The next step, of course, is the touch. The touch is the most important part of this examination. The reason is because when you touch, you are able to feel, and when you touch, you know exactly what you're touching, and you can be able to describe it to your doctor once you notice anything that is abnormal. So here is what you're going to do. In the same position whereby you have looked into the skin and the surrounding area of the breast, including the upper part of your shoulder here towards the armpit, which is what we call the axillary region, you want to touch, and you're going to touch with the soft pad of your fingers, not your fingertips, because some ladies have their nails fixed up. You don't want to injure yourself and you don't want to puncture any hole into your skin. You want to make sure that your hands are clean and dry before you start this examination. So you're going to use the soft pad of your fingertips to apply some pressure on yourself in order to be able to go through this test. It's as simple as this. Once I raise my hand up and I'm still looking at myself in the mirror. Remember, look was the first step. I go ahead to start my pressure feeling around my axillary or my armpit. Once I touch and I see that I do not feel anything abnormal, I start to move down. Now, moving down, you move down in a circular motion, and I'll show you in a bit. So I move like this, I move like this, I come up towards my axillary region. I'm applying pressure with this soft part of my fingers. I am here right now, and right here is still some of my breast tissue, and I'm going all the way down to the major breast area. As you can see, I'm on the outer skirt of the whole breast tissue I have here, and I'm going to just move in a circular motion. Once I move in a circular motion, I will move from the outer portion to the innermost portion. So as I've moved from here, you see my hand is now here. So I go, so I'm trying to feel for any dimpling, any lump, any mass. And I keep moving until the circle gets smaller and smaller, and I stop right at my nipple region. Once you stop right at your nipple region, you stay there and you apply some pressure around there softly and gently. You want to feel for any mass or any lump around the areolar region and around the nipple as well. You're going to repeat the same process on the other side of your breast. Remember to feel from the armpit region, come all the way down and start in your circular motion from the biggest part of the circle and move smaller and smaller and smaller and smaller until you get to the areola and the nipple region. Once you're through with this, make sure that you note your findings. So for example, in the month of October, no visible changes or no finding. In the month of November, you're going to repeat the same process. Once you see any lump or feel any lump or mass, you can use a marker to mark that region where you noticed any lump or mass. You can quickly report to your medical doctor or general practitioner or your general physician to take a closer look and go through with the next step. Before I go, here's a fun fact. Breast cancer does not only occur in women, it also occurs in men as well. When in doubt, try to watch this video and try to do this examination again. This concludes the breast self-examination today. I hope this video was informative. I hope you learned something today. I hope you learned how to be able to diagnose early breast cancer. Early prevention, as I've said in my last video, is better than cure. So knowing how to do this is absolutely utmostly important, guys. It is so important. It can save lives, it can save money, resources, and just so much of stress. You can alleviate those things once you are able to perform this test by yourself. As I've said before, when you are in doubt or you are not sure what you're doing, watch this video. This video is the simplest one you can get out there to help you conduct this examination. Once you are able to get this examination, you get it for life, and that's it. I thank you for watching. Until next time, please subscribe to my YouTube channel if you haven't already done so, and I will see you in my next video. Bye.